Good morning, Lord Brailsford.
Good morning, Mr. Stephen. Now, you have a witness for us?
Yes, my lord. The first witnesses giving evidence today are Jennifer Miller and Elizabeth McElwraith, both of whom represent PAMIS and will be giving evidence together as a panel of two.
Very good, thank you. Good morning, Miss Miller, and good morning, Miss McElwraith.
Good morning, Lord Brails.
Thank you for coming. Now, when you're ready, Mr. Stephen.
I'm obliged, my lord. Miss Miller, if I can start with you, could you state your full name, please?
Yes, I'm Jenny Miller.
Thank you. And Miss McElwraith, could I ask you to do the same? State your full name.
McElwraith.
Thank you. You've both helpfully provided written statements to the inquiry, and for the record, the inquiry reference numbers for those statements are SCI-WT 0460-5008 for Miss Miller and SCI-WTI 0388-5001 for Miss McElwraith. Jenny, you already gave oral evidence to this inquiry previously and a written statement in respect of the health and social care theme, and that reference number is SCI-WT 0460 and then 5 zeros and a 1. I'll just reiterate at the outset that everything you said in those written statements will be taken into account by the inquiry, even if we don't touch on every aspect of those in oral evidence today. And just a gentle reminder that the hearing is being transcribed, and the Chair, Lord Brailsford, will also be listening intently and taking notes, so please do try and speak slowly and clearly, as I'm sure you would do, and I will try and do the same. Thank you. So the organisation you both represent today is PAMIS, or Promoting a More Inclusive Society, is that correct?
Yes.
Thank you. And Jenny, your current position is the Chief Executive Officer of PAMIS?
Yes, that's correct.
And that's a role you've held since 2015?
Yes.
Thank you. And Elizabeth, you are the transition lead for Glasgow City for PAMIS, is that right?
Yes, that's correct.
And how long have you held that role for?
14 years.
Thank you. And in broad terms, what does that role as transition lead involve?
I support families who have got relatives with profound and multiple learning disabilities, who are aged between 15 and 19 and who are approaching the transition process from education services into adult services.
Thank you. And we'll come back to transitions in due course.
Thank you.
But first, could I just ask in a nutshell to describe what the core mission or aim of PAMIS is, please?
Yes, I mean, we are the only organisation that solely supports children, young people and adults who have a profound learning and multiple complex disabilities and their families. And the mission is to assist them to lead healthy, inclusive and valued lives.
Thank you. And that profound learning and multiple disabilities is sometimes put in shorthand as PMLD. Now, at paragraph 6 of your witness statement, Jenny, you say that PMLD is not necessarily a term that's commonly used within educational settings, and as you both know, these impact hearings are looking at education and certification. For those unfamiliar with that term, could you please describe what that means, PMLD?
Yes, so we talk about the profound learning, which means that they have limited cognitive abilities and developmental delays, which means that many of them have limited communication, are unable to do tasks that lots of us take for granted. But the multiple physical disabilities means that a lot of them will be wheelchair users, that they have continence issues, that the majority of them have epilepsy, that they have issues around musculoskeletal, so they will end up, I think you heard a lot about postural care before, so they will end up with physical disabilities if they're not supported correctly, and very complex healthcare because of those physical disabilities. Often they'll end up with respiratory issues, so things like COVID had a really big impact, because if they become unwell, that often then relates to them getting pneumonia and being in very critical positions. But we also use that word profound because they have communication difficulties, often to mean that we often don't know what's going on. So it's deep, wise and expert, and they teach us an awful lot as well. And their lives are very valuable, but you need to take time to understand how they communicate with you. And just finally, they communicate in a different way, and so sometimes their communication can be seen as very challenging. So they're trying to tell you that they're feeling ill or unwell or in pain, and that comes out maybe in an aggressive manner, and so that can often be misconstrued. So they have a real risk of being diagnostic overshadowing and people thinking it's their learning disability rather than something else happening. That wasn't really in a nutshell, sorry.
Thank you. But I think the factors that you've outlined there, the features of PMLD, that makes them highly dependent on others. I think that's something that you say in paragraph 8 of your statement. But I think importantly, it's also a varied group, and I think you say at paragraph 6 of your statement, Jenny, that the abilities of those described as having PMLD will vary considerably. So are there differences in terms of their abilities?
Yes, so some people will be very mobile, and you know, and that has its challenges, and others will be confined to a wheelchair or confined to, you know, specific seating equipment. Often, you know, spending quite a bit of time in bed as well, you know, using postural supports. So some of them are able to move around and take part in a range of activities, and others have to have everything done for them. Some of them will need very, very specific equipment in order to enable them to take part even in daily living activities, and others, you know, are as I said, far more mobile, and it's quite difficult to diagnose. So we often talk about that severe to profound range.
Thank you. I'd like to, before we get to the pandemic period, I'd like to focus on the school experience first for those with PMLD. At paragraph 9 of your statement, Jenny, you state that the way that an individual experiences education with an individual with PMLD may look quite different to someone who doesn't have that, but in essence it's the same concept, and you highlight the daily attendance, access to the curriculum, albeit an adapted curriculum, participation in the social world of school, plus access to other healthcare practitioners and equipment, as you just mentioned, and specialist interventions. Now, I want to take each of those aspects in turn, if I may. So if I could start with you first, just in terms of the getting to school. How does an individual with PMLD normally travel to school in the first place?
So all of them will require transport to get to school, unless of course they live round the corner and they can be pushed or walked. So but that transport will require escorts as well. So nobody should be travelling in a car without somebody supporting them. So they might go in a car, they might go in an adapted taxi, or for a lot of our group they go in adapted wheelchair buses.
Thank you. And that is not necessarily a short journey that they're undertaking, is that right?
No, many of them live across areas, so that the specialist school that they go to will be not even in their geographical area. So no, I think for some families it can be up to an hour, Elizabeth, can't it, in travelling? So.
Yeah, so it's some families may live within one local authority, but their son or daughter will be schooled within a different local authority. So obviously travelling at peak times, it can be prolonged periods of time that they're on school transport, but yeah, as Jenny says, the biggest majority of the families that we support are dependent on school transport, whether that be an adapted school bus or a taxi, and with support. So there would be an escort either present with them within the taxi, or there would be an escort present on the bus.
And the reason for that escort is because of their needs, is that
Yeah,
right?
they're complex healthcare, but also the way that maybe they communicate as well. So.
And that reason for travelling out with their local authority sometimes, Elizabeth, is that a reflection of where they need to be for their educational needs, just wherever that facility happens to be?
Yes, absolutely. So for the specialist input, really, yes, So if their own local authority can't provide, that specialist input and meet their support needs, they may well travel to a different local authority who's maybe got a specialist school who can provide that level of support that they require.
Thank you. I want to ask next then about the social aspect, and I think, Jenny, you mentioned this in your statement at paragraph 20. I think you say that one of the most important aspects of school for children with PMLD is socialisation. Why do you say that?
So for so many of them, they have no opportunity of going out in their community because of lack of accessible venues, lack of changing place toilets, which is the area that's needed to help support their personal care needs. So the school is the only opportunity for them to meet their peers and their friends. And, you know, the caring role is 24/7. And if you have a family, you know, trying to organise a day out is difficult enough, but trying to find a venue that's accessible and supportive and activities that engage the whole family is really difficult. Going to school is a time where you meet your peers and you have staff and, you know, individual support that enables you to engage and communicate.
Thank you. Elizabeth, anything you'd add to that?
I think for many of the families that we support, there's a real lack of activity within their own local communities. As Jenny says, you know, there's issues around access. Not all families have access to an accessible vehicle, so they're maybe relying on public transport. But there's very few activities that are actually organised and set up to meet the needs of individuals with profound and multiple learning disabilities. Therefore, they are, to a certain extent, you know, still excluded within their own communities. So school does sort of provide that motivation and stimulation and the opportunity for them to go and meet their peers and mix with their peers and have fun. So, yeah.
Thank you. On the curriculum then, next, at 13 of your statement, Jenny, I think you say that some children with PMLD will attend mainstream schools with specialist units, and they'll attend special schools in some instances. And I think you mentioned that the curriculum will still focus on the Shinari wellbeing indicators and also GERFEC, and the inquiries heard already from evidence last week, I think from Play Scotland and Early Years Scotland on those. But you talk about obviously the adaptation of that curriculum for children with PMLD and the skilled role that's required of teachers. I just wonder if you could elaborate a little bit. We'll come to additional support and other professionals, but just focusing on teachers, why do you say that it's a skilled role? What does that involve in adapting that curriculum for children with PMLD?
So breaking down activities into the minutest details so that an individual can actually engage is a completely different way of how you would normally deliver education. And I think the teachers have to be incredibly creative in enabling people to consider science in a very different way. So, you know, their multi-sensory skills, their use of stories, their use of props and activities, you know, it will be very, very different from what you would use, you know, with a mainstream. So I suppose, you know, you have people that develop activities in nursery level, but it's then about trying to make sure that you're age appropriate, but you're giving people activities that are enabling them to take part. They also needing to be the expert in thinking about how they're positioned, you know, how their hands are enabled to be able to take. So they're having to take on all the allied health professions and you know, the medical direction, as well as their education role. So I mean, that is a vast job and you know, requires people to think, I think, quite differently and to be a really great team player.
Thank you. We'll move on then to the support of other professionals, because you just touched on it slightly there, and you both speak in your statements about, I think, the range of other professionals that are involved working closely with teachers to make sure and support access to the curriculum for those children with PMLD. And I'd like to highlight some of those and bring those out today. What would you highlight as the key support which, for example, speech and language therapists offer to those children with PMLD in the school environment?
So they'll work, sorry, I'm hogging it. They'll work, you know, on communication and thinking on those early stages of how people communicate, and they support them with assisted and augmentative communication. So, you know, in enabling the teachers to think about how they present information and then how the child is interacting and providing that input. But equally, you know, they also need to think about how that child is taking its drink or his food or her food, because, you know, a lot of them will have swallow issues and, you know, the need to be really, really clear about how you enable people to take part in the broader sense of, you know, because quite often tasting and touching food is something that's really, really important. But they will provide that structure and that very specific assessment that they then can translate with the teachers into putting it into practice. whether you want to add.
Anything you would add, Elizabeth, to that?
No, I think really just the partnership working that goes between not just teaching staff but support assistants and health and wellbeing workers within the school, and the input. So speech and language therapists may well put in place plans and you know, different forms of communication and things like that, but it's their knowledge and skill that they then impart to, you know, teaching staff and support staff and health and wellbeing workers, who are the staff who are, you know, front line, who are then implementing that. So it's that real partnership working, and sharing information and skills and expertise, and that's really, really important for our group, to make sure that there's that consistency happening as well.
Thank you. And Jenny, in your answer a moment ago, you mentioned AAC, which is augmentative, I understand, and alternative communication. Can you just give an example of that for those who might not understand what that means?
Yeah, so I mean, it can be as simple as pictures, where you give somebody two choices, and one will be that they want a drink and the other will be that they want a food. So you're assisting them in thinking about how they make those choices. But equally, they provide access to some incredible equipment like eye gaze, which is enables people that have no verbal communication to use their eyes to communicate what they want, and that can turn that into language actually, so they can hold conversations. So for some people who've maybe diagnosed with a profound learning disability, it can open the whole world, because it means that maybe they haven't got the profound learning, but they just don't have the communication. So it provides insights into how people are developing and communicating. So, and there's a whole range of equipment, but you need a speech and language therapist to do the assessment in order to be able to access it.
And we'll come back to equipment in a moment, but I also wanted to ask you about examples you would highlight of support given by occupational therapists and physiotherapists, because that's another group of professional, I suppose, that you highlight in your statement as important in that school environment for children with PMLD.
Yeah, I mean, their role, so she's sitting up straight on postural management, you know, is so important, because if we don't work with kids at a very early age, then we end up with all the physical health problems. So they are the absolute experts on providing that support and the treatment and the assessment and making sure that they're in the right position. So the physio will provide standing frames, equipment, some of the specific seating, and then the occupational therapist can come in and talk about the right positions so that people can actually engage in activities. So again, I mean, it's that partnership approach where a teacher wants to do an activity, has to have the kid in the right position, but then also needs the aids and adaptations to enable them to use their upper limbs to actually engage in activity. And sometimes it's also about that sequencing and breaking down of activities, so you're putting them into really tiny components that enable people to make progress. And it's that whole team approach that allows those children to develop skills, and for us to see them developing those skills as well. And I mean, this group teaches how to work as a team, and that is so very essential, pulling people's expertise in to look at that. And one thing I suppose I didn't mention is looking beyond behaviours. You know, the speech and language therapist, the OT, will help the teacher look beyond a behaviour that might seem like somebody's just acting out, when actually what they're trying to do is to communicate, or they're bored because they've actually reached their potential and you're not stretching them far enough.
Thank you. And on that physical aspect, you talked about appropriate positioning, for example. What is the potential consequence if that physical side of things is not looked after for these children, this group that you represent?
Because of their complexity, you know, that we talk about a windswept, where somebody's body, if not put in the right position, gravity takes over, and the musculoskeletal, their spine, the curvature of the spine begins to develop, and then you end up with organs being crushed internally, and you know, your lungs capacity is reduced. Michelle would have made it far more explicit, but it's such a fine time, you know, between, and particularly actually going into adolescence, when there isn't enough research, but we recognise a real rapid increase in physical musculoskeletal deterioration. If that happens, you know, that then when you get a respiratory infection and your lungs are impacted because they're squashed and compressed, you're far more likely to end up at the risk of dying because you haven't got the necessary physical ability to fight it.
Thank you. You also mentioned, Jenny, at paragraph 12 of your statement about there being nurses, I think, also in these schools. And again, is that something you'd highlight as important, either nurses being present within the school or on call to meet the demands or needs of children with PMLD?
Yeah, so the kids that we have that are really, really complex, you know, their parents are absolute experts, and in a way, sometimes at home, they have like a hospital at home, and they're totally in tune with when people need to have a suction, or they know when somebody's having a seizure, how they need to administer medication. That, you know, you can't expect the teachers to be able to stand down and do all of that when they have a class. So having that team that have that expert medical knowledge is absolutely essential, and that has been what's enabled our children to go to school. Without that, they're at risk.
Thank you. Paragraph 18 of your statement, Jenny, you also mentioned personal care, I think, is something that's important and takes up part of the school day. What does that involve for those that might not understand it, and how much of the school day is taken up by personal care for these children?
So nearly all of the kids that we support have are incontinent, so they have nappies, pads, continence aids, and they need to have those obviously changed on a regular basis, and that needs to be done in a specialist room with dignity and respect. So we talk about changing place toilets, it would need to be on a changing bench, we would need to have a tracking hoist that enables people to be moved in there, and they are, you know, that they're then supported to like you and I have, you know, when you go to the toilet, you go to the loo, and you need to be changed, and that needs to be done on a very regular basis. But their personal care needs and that also, you know, entails them coming out of their wheelchair and being able to be stretched out, and you know, quite a few of them have swallowing difficulties. So, you know, it's about changing their tops as well, because it might have got soaked because they've been drooling. So, you know, there's a whole aspect that goes around there, and then of course that support for eating and drinking is really an intense time as well, but it needs to be made an enjoyable time, so you need that one-to-one support within a dining room as well.
You mentioned eating and drinking, and at paragraph 19, I think, of your statement, you talk about how lunchtime is very different to that of mainstream schools, and I think that's what you're alluding to there. That will be a different experience for many of these children with PMLD.
Yeah, so many of them are peg-fed, so they don't actually take food orally. But for a number of them also, they aren't able to feed themselves, so they need that support. But the peg feeding can take a number of hours.
It just really depends on the individual themselves and whatever support plan has been put in place for their eating and drinking. But yes, we've got lots of children and young people who have nasal gastric feeds, who have peg feeds, and who also have blended feeds. So it really is very individualised, and that does obviously mean that there needs to be somebody with them at all times to administer those feeds, make sure that the rate of the feed is going how it should, make sure that as well as they're receiving their feed, that they're also receiving their fluids. So it can be quite complex. Staff members need to be trained, they need to be confident in administering this for the young person, but there's so much more involved. It's not just about making sure somebody's fed, it's making sure that you're giving them eye contact, that they're positioned correctly, that you're interacting with them. You know, it's a mealtime experience, so you know, you need to be talking to them and meanwhile continually assessing them and making sure that they're all right. And for those individuals who maybe not need that level of support, lots of the families that we support, their children and young people will require to be fed by somebody. So it could be that it's a blended diet that's being fed orally to them, or that they need really, really close supervision because they're at high risk of choking. They may well overload their mouth if they are able to kind of load their own spoon and administer that food to themselves. So it's quite a complex process. And it's got a high staffing ratio as well. So lunchtime can take, you know, an hour and a half to start to finish, just depending on the individual's kind of support plans.
Thank you. Moving on then to equipment, and this is something that Jenny, you've touched on already. I was just going to ask if you talk about how at paragraph 11 of your statement, Jenny, that many of the schools are adapted to the needs of those with PMLD and the range of necessary equipment. And I think you've given some examples of that already. Does that equipment also require specialist training on the parts of teachers or other staff to operate that? Is that correct?
Yeah, absolutely. I mean, you need to get the children into the right position if they're in a standing frame. People need to have done moving and handling and positioning courses so that they're moving people safely. You know, hoisting somebody might look really simple, but if you get the wrong sling, the wrong position, you know, you can do all sorts of damage. So there should be training, regular training, and then support. And quite a lot of the moving and handling requires two people as well to get people into that right position. So yeah, I mean, the equipment's complex and very varied, but the school has the most, particularly adapted school, the most amazing environment where there are tracking, you know, hoists, where there is loads of different standing frames, where there's lots of different equipment for upper limb function as well. So, but yeah, definitely needs training and support.
Thank you. Elizabeth, anything you would add to that?
No, it's just that partnership working, you know, between the allied healthcare professionals and the teaching staff and support staff and health and wellbeing staff. Yeah.
Thank you. To sum up then on the school environment, I think, Elizabeth, the way you put it at paragraph 35 of your statement is that the school environment is all-encompassing of the support and healthcare needs of children with PMLD. Would that be fair to say?
Absolutely, yeah, it is, you know, and I think what we haven't touched on is just how much the family play a part in that role as well. So schools are very open with families, you know, they kind of take their thoughts and their considerations on board, and frequently, you know, family members will go into school to show the staff within the school environment, you know, how they do things at home if they're perhaps struggling, to maybe get somebody seated in the correct position, or to get them maybe relaxed for meal times, or maybe if personal care is becoming quite challenging. So, you know, families very much work in partnership with schools, schools work in partnership with families, and then you've got the kind of overarching kind of allied healthcare professionals who are working in partnership with the team at the school and also the families. So it's a really close-knit community.
A team effort, I think.
Oh, absolutely, yeah.
Thank you. I want to then turn to the pandemic period against that background of what school generally means for those with PMLD. Jenny, if I start with your statement, paragraph 21, I think you say that even before schools were closed due to the pandemic, there was a lot of anxiety amongst parents and carers about sending their children to school. Were there any particular anxieties or vulnerabilities that those caring for those with PMLD had in mind at that time?
I mean, their awareness of the risks associated with any infectious disease is always, I mean, they risk assess from the moment their child is born. And I think the fact that they knew that this was a respiratory issue, and that if their kids developed, you know, they were worried about flu, you know, the previous year, but if their kids develop a respiratory infection, that can often lead to then a very serious chest infection, which can lead to pneumonia. And their biggest risk is, if that all takes over, their kids are more likely to die of that than children that don't have a profound learning and multiple disabilities. So they're always aware of that. You know, we were always aware that if anybody had a cold, you had to sometimes cancel sessions. So I think they probably were far more aware. And I remember talking to a mum who said, you know, I don't feel safe sending my daughter in because, you know, people are sniffling and sneezing. And if she gets that, then, you know, that could be the end of her, or that will be a very intense time when we're, you know, might end up in an acute hospital.
So to your knowledge then, even prior to the official lockdown or closure of schools, if you like, is it your experience, PAMIS's experience, that families were choosing not to send their children into schools?
There were some families, particularly of kids with very, very complex needs, that were saying, I'm really worried and I'm not sending her in next week. I don't know whether you had more experience.
Yeah. I think as families were understanding COVID better, as we were getting more information through the media, but as we were also seeing other countries who were more advanced, they were taking the decision to remove children, young people and older people from schools and day services, particularly those who are very vulnerable, because most of the families we support, you know, the last thing they want is a hospital admittance, because the seriousness of it. And the likelihood is that, you know, the kind of longer term health implications, or even perhaps death. So yeah, they were very, very cautious.
Okay, thank you. When schools did actually close, paragraph 22 of your statement, Jenny, I think you speak of an element of relief when that happened. Why were families relieved about that happening?
Well, I think then they felt they didn't have to justify not sending their child in, and they, you know, they were then in their environment where they were able to control that sort of safety. So, you know, so for many of them, I mean, I know when they were talking about, I'm not sending my child in, but somebody's going to phone up and ask me why I haven't, and, you know, and you know, threaten with a legal case because you've kept your child out of school. So I think it was that feeling of being able to keep somebody safe and, you know, cocoon them within their home for that initial period.
I think, Elizabeth, as well, in your own statement at paragraph 58, I think you talk about how vulnerable sort of the children and families were supported by PAMIS. And I think you say the same thing at the beginning. They just wanted to keep safe and keep themselves to themselves. Is that right?
Yeah, absolutely. You know, for families who are supporting individuals with very vulnerable health, I would say that they were the first ones, you know, to start to withdraw from schools and day services and things like that. And when schools did close and lockdown happened, you know, I think they were very relieved, because obviously it's a very uncontrolled environment. You know, whereas at home it's far more controlled, and they've got more control over that environment as well.
Now, as that closure went on, the pandemic continued. I think at paragraph 23 of your statement, Jenny, you say that it didn't take long for the enormity of the situation to be realised. And we'll come on to the impacts on the children themselves shortly, but I want to start with the impacts on the parents and the carers of those looking after those children. What did the closure of schools mean in practice for the roles and responsibilities that were having to be undertaken by parents and carers when schools were closed?
Well, suddenly they were the lone carers for many of our families. They are single parents, and you know, that respite when your child goes to school, of at least being able to catch up with what else is going on in the home, suddenly there's none of that, and you're there 24/7. And for many families, you know, it is 24/7. They're up in the night. They're, you know, that care is really, really intense. And not only the care of that child, but many of them had other children as well, or other caring roles. So suddenly that is all on your shoulders, and you're there all by yourself with nobody coming in. And I think, you know, as we've spoken in the past, you felt very much that actually nobody knew you were there. You were invisible and you were isolated. And yeah, that responsibility must have been horrendous, absolutely horrendous.
And Elizabeth, I think you make a similar point about, you know, many of the families you deal with being single parents. What was the feedback or messages you were getting from the families you deal with about the impact on them with schools closing?
I think, as we've touched on previously, I think initially, you know, in the early stages of COVID, there was that sort of relief, you know, but I don't think anybody envisaged, you know, being at home for such lengthy periods of time. And as Jenny says, we do have a huge amount of single parents who are caring for their children and other siblings as well. So it was just the enormity, you know, the enormity of, you know, being the sole carer, all other service provision, you know, being withdrawn, and just trying to cope with all the different aspects. And a lot of it, you know, for children and young people was just being at home all the time, 24/7, you know, 7 days a week kind of thing. It was just so difficult, you know, for parents and carers, and just the time that it went on for, you know, was very difficult.
And Chris, if we think about that whole team approach, so in a school you have that whole team, and suddenly mum is the physio, the speech and language therapist, the OT, the teacher, the carer, the doctor, the nurse, you know, doing that over that period of time was absolutely exhausting, wasn't it?
Yeah, the exhaustion, yes.
And Jenny, you spoke earlier about how mobile some of these children can be, and I was going to ask you, Elizabeth, about whether the home environment, as you just said, that they were spending all of their time in, what was that like for families who obviously had very mobile children with PMLD? What experience were they having?
Certainly the feedback that I was receiving from families was, you know, split into two camps, if you like. So for families who were supporting individuals with very physical, complex disabilities, it was exceptionally hard because physically, you know, it's a very difficult role to take on. For families who were supporting individuals with PMLD, but those individuals who were mobile, it was a different role, and in lots of ways probably more exhausting, because a lot of the school day for individuals who are very mobile and need to kind of expend that energy, it's kind of outdoor learning, and obviously that's what they're used to. They're used to being outdoors and kind of exploring their environment and doing different things in the fresh air and within that environment and burning off lots of energy. So for those families, they couldn't do that. For the young people, they couldn't understand, you know, why they couldn't go out, why they couldn't go into the garden, different things like that. So it was just very difficult because the behaviour spiked massively, because obviously the young person had all this energy that they couldn't do anything with. They couldn't understand why they weren't going to school, why they couldn't go out. You know, for those individuals, many of our families also live in flats as well, so there was not necessarily any kind of protected garden space. So it was very difficult for those families, and for the young people. Obviously, you know, it's extremely difficult to understand what was happening.
And Jenny used the word invisible earlier on, and when I was reading your statement, the word isolated, I think, comes up quite a bit. Elizabeth, was that again a message you were receiving, that families felt isolated during that period? Yeah,
absolutely. I think to kind of put it into context, so for many families, they have support packages in place, so they maybe have the same staff members coming in kind of morning and evening, certainly, and at weekends, you know, maybe a different schedule, but there is that level of kind of continuity of support staff who come in and kind of share those support needs with the family. So that stopped. But I think for many families, the support teams who are in the home, you know, providing levels of support, they're more than just support staff. They do sort of become part of the family. They're there, you know, sometimes they're the first people that families see in the morning, the last people that they see at night, and there's just sharing of information and emotion, you know, about life events that happen. So, you know, they did become very isolated, and for lots of our families, you know, it's support workers who are their main network of support, rather than necessarily being friends or family who are supporting them. So they were very isolated.
And what did that mean in terms of respite then for these families?
There was none. Absolutely no respite whatsoever.
Thank you. I wanted then, on a related note, to ask about the mental health of parents and carers during that time. I think, Elizabeth, you mentioned this at paragraph 97 of your statement. You mentioned that there was an impact on the mental health of parents and unpaid carers. Would you be able to elaborate on that?
I think, you know, from the information we've just described, you know, I'm sure it's painting a clear picture of how families were having to live for prolonged periods of time, and obviously that isn't healthy for anybody, but for the parents and carers that we were supporting, their needs came last. You know, they had to focus on the individual with PMLD and any other children that they had, the isolation, the lack of, you know, other human contact, you know, the lack of taking into consideration their own health. PAMIS quickly moved from kind of face-to-face contact with families to online contact, and we developed some parent-carer kind of support networks. So we would meet in the evening, usually around 9 o'clock, once their care role had kind of eased slightly, and it was just an opportunity for parents and carers to come together, have a coffee and just chat about some of the experiences that they were having, some of the difficulties that they were having, and just sort of receive a bit of kind of informal support from other people who could understand what the day-to-day nitty-gritty of COVID and being at home was really like, and it was really apparent through those conversations. We were really just facilitators and bringing families together, but the conversations that they were having, it was really apparent just how difficult life was, the isolation that they were facing, the deterioration in their own mental health, but also the mental health of the young people that they were supporting as well, and the changes that they were observing in things like sleep pattern, communication, behaviour, posture, you know, all these different aspects. So it was absolutely enormous, you know, it was huge.
Thank you. And we'll come back to the children shortly. Continue with mental health. Jenny, at 28, paragraph 28 of your statement, I think you mentioned PAMIS making a contribution to a report by the Health and Social Care Alliance. This was in May 2020, which was a response to the Education and Skills Committee inquiry. You provided a copy of that to the inquiry, and the reference for that is SCI-PAMIS X and then dash 5 zeros and a 6. And at page 2 and paragraph 2 of that document, it says, and I'll just read it, as paid carers are shielding or avoiding physical contact, some families are taking on a 24/7 caring role. This is a real struggle for unpaid carers who are exhausted and concerned about their mental health, their own well-being, and that of their child or young person. They've also lost the protective environment of school services, can have reduced support packages, and many have additional children requiring homeschooling support. PAMIS raises that some families are at breaking point and that urgent action is required to support this group. Is that a fair reflection or encapsulation of how families were feeling at that time?
Yeah, absolutely. And that breaking point had various connotations to it as well, you know, depending on the mental well-being or the lack of sleep or of that family carer.
Thank you. I want to move on then to the impacts on the children themselves, and I want to start with their physical well-being. Earlier in your evidence today, we touched on the necessary equipment that's provided in schools, as well as the wider work done by health professionals in that environment. I'd like to try and take each of those in turn. Starting with the professionals themselves, at paragraph 26 of your statement, Jenny, you talk about the reallocation of healthcare professionals at this time, and you talk about the disappearance of services for those that you support. What were the services that disappeared, and what was the consequence?
Yeah, for many, people were I mean, it was a crisis that we'd never been in before, but to reallocate an allied health profession whose specific role is to support this group of people, it felt criminal, actually. It felt, you know, why would we do that? And we had practitioners that were going off and, you know, not being in the role that they were trained to do and doing things that maybe another person could have done, but taking away an occupational therapist or a physio or a speech and language therapist, albeit not having your hands on, to take them away from providing that support and advice. Just, we warned right at the beginning that would have implications, that our folk might not get COVID, but the implications of not having interventions means that the that COVID will have a long-lasting life in threatening impact. That didn't happen in every area, but where it did happen, and I mean, I remember having a discussion with a lead at the Scottish Government about saying, why are people accepting that and not just challenging it? Because it just felt so wrong that all of those services were taken away. And families were left doing things that they hadn't been trained to do, because that was the things that had happened in the school. It just felt so wrong.
And I think at paragraph 86 of your statement, you talk about that reallocation perhaps being something that's continued. It's a lasting impact.
Yes, so people, I mean, we have a real shortage of health and social care practitioners. People have either retired or haven't returned to their roles, and so, you know, services are really scarce. And trying, I mean, in the UK research that we contributed to, you know, one of the recommendations was we need to undo some of the harm that was done. We need more allied health professions to look at particularly at physical issues that have come out. So we were asking for an increase, and yet that there hasn't been the return because there isn't the workforce out there.
Thank you. I want to turn then to the equipment side of the equation and the impact that the closure of schools had on access to that equipment. And I think this is something you, Elizabeth, speak very helpfully about in your statement. As a practical matter, the families that you were dealing with, were they in a position to either store or know how to use this equipment when schools closed?
Not all of them. I think there are some families who were within living environments that, you know, that they could then either have equipment at home that was already in use, so they continued to use that as we progressed through the pandemic. Some families, as the restrictions eased slightly, some of the schools that I was involved with did try to get equipment out to families, but again it very much depended on the living arrangements, because these are big bits of kit, you know, standing frames, achiever beds, they're not, you know, small items. So for those that had houses that could accommodate, great. For those that lived in kind of flats and things like that, maybe small houses, there was no way that they could fit these pieces of kit in, so obviously that kind of therapy intervention just couldn't take place. You know, it was as simple as that. It just couldn't happen for those individuals.
And Chris, one other really important point is that the kids had less physical activity, and a large proportion of them grew, both lengthwise and body-wise, and the equipment then came to a stage where it didn't fit anymore, and there was, so that withdrawal of the allied health professions meant there was nobody doing those reassessments, so people were being put into equipment that wasn't correct, or they were being sent pieces of equipment that hadn't been properly assessed. And I remember us running a moving and handling workshop, and families were saying there were things arriving in the post that hadn't been assessed properly, and then they were being, you know, weren't being used effectively. So that, you know, that even having the equipment in there didn't necessarily mean it was right over that length of time that they had their children at home.
And at paragraph 95 of your statement, Elizabeth, I think you make the point that therefore, even if families had wanted to ensure postural care plans were being carried out, they couldn't. And I think you say in your statement, this came with the knowledge that every day this would impact their loved one with a detrimental impact on their posture and possibly their health.
Yes, absolutely. And also, you know, the fact that for some parents, those who were single parents, even if they could have got the equipment, they could not have physically have made that transfer from the individual's wheelchair to getting them maybe in an upright standing position, because the risk was too large that one, they would either injure themselves or they would injure the individual. So it wasn't just solely about equipment, it was also about manpower as well. You know, so you can have a mum who's maybe relatively small trying to, you know, manoeuvre somebody who can be quite large. So there's high risks involved there as well. So yeah, it was very difficult for families.
Thank you. And to your knowledge then, has there been a longer term physical impact on some of the children with PMLD that you deal with, the families that you deal with?
Yes, yeah. So there has been a longer impact, and the impact has been on their postural care, and for some individuals that's irreversible. You know that the damage has been done, and that can't be reversed. There's nothing in the world that's going to change that. So that there has been a long-lasting impact.
Thank you. I wanted to touch now on the loss of structure and routine. This is something that you both mentioned in your statements. I think has been detrimental to children with PMLD when schools did close. What is the importance of routine for these children, and what were the impacts that you were made aware of as a result of that removal of the routine when schools closed?
Do you want to start with that?
Structure and routine is vital. It's absolutely vital for the group that we support. It helps them understand their day. Many individuals will use now, next and then boards to help them understand, you know, what's happening just now, what's going to happen next, and what's going to happen afterwards. So that's all part of their kind of structure and routine, and that's been implemented over a long period of time. And when that stopped, they couldn't make sense of their world. You know, they couldn't understand why they weren't going out to school, why they weren't seeing their peer group, their teaching staff, you know, their support staff, all these different changes, and frequently it manifested in, you know, loss of communication, you know, interference with sleep patterns, but a real kind of spike in terms of kind of behaviours towards others and behaviours towards themselves. So it had a really, really negative impact on their life.
And for some it was a withdrawal as well, that when they couldn't make sense of it, they shut down, and so they weren't engaging with any activities. I mean, all activities need to be facilitated and enabled, and actually if you're exhausted after doing 24 hours with broken sleep, you know, trying to put in that structure is really difficult. We use a lot of rhyme, rhythm and repetition. It's doing something again and again, which then enables all the brain to start to develop skills and to develop patterns of movement. And you know, when those are broken, that can regress. And I remember, I mean, one of the very negative impacts on the families was that thought that their child had lost skills that they'd spent years developing, and suddenly they were going back to being withdrawn. They weren't engaging with activities, they weren't communicating in the way that they had. And that was such a vivid memory of families talking about somebody had put their head down and they hadn't lifted it up for weeks. It was, yeah, really difficult.
Thank you. Which leads me on, I think you've touched on it to an extent, the mental health of these children, the impact it was having on them. And Elizabeth, at paragraph 97 of your statement, I think you say that this can be a bit more tricky to recognise sometimes in those with PMLD, but those who know them could see that deterioration, could see that change. So my question to you would be what were the hallmarks or indications of that impact on their mental health that families were seeing and conveying to you?
I think it was that lack of engagement, and that could be, you know, a lack of giving, you know, eye-to-eye contact, you know, stop communicating, stop engaging, you know, stop participating in the activities that they've previously been able to participate in, and it's just that, you know, withdrawal, essentially, where they cannot communicate to their parents and say that they're sad or how they're feeling or understand those feelings, but it manifests in different ways. And for the families that we were supporting, that was the feedback that we were receiving. It was about how the individual communicates, which would probably mainly be, you know, through the use of vocalisation rather than through verbal words, perhaps using picture exchange cards or using their signs and their symbols. You know, stop engaging in all those activities, and they're all vital because that is how parents interpret, you know, how individuals are feeling, what they're thinking, what they're wanting to do, how they're feeling. So that was the information that we were receiving back from families of their observations of their young person within the home.
And I suppose for some there was also self-injurious behaviours where people are, you know, picking or head-banging because they're just confused and frustrated and don't understand what's going on. And again, I think Elizabeth mentioned about the sleep patterns, that those changed as well. Yeah.
Thank you. I want to move on now to online learning, because when schools closed, education, the delivery of education moved online. Jenny, at paragraph 31 of your statement, you say that there seemed to be a lack of support for children with PMLD being schooled at home versus their peers without learning disabilities. What, in your experience, what support or engagement was taking place with those families from schools and local authorities?
I mean, Elizabeth will correct me, but for many, I mean, it was a terrible time, wasn't it? Teachers were suddenly thrust into this completely new role, and thinking about how you might engage educationally with a group that have a lot of sensory deficits. I mean, we spent quite a bit of time working out whether we could use Zoom and how we could work with them digitally, working with experts. We had the benefit of having that time to talk about it. But I think it was maybe for some schools a bridge too far to think about their needs when they were busy trying to cover every other child, particularly, I guess, if they maybe weren't convinced that was going to help. So I think a lot of families felt that actually they were abandoned. I know later on, you know, there was more outreach, but certainly initially, I think families felt that they were left to their own devices and that their kids' education wasn't as important as everybody else's. I don't think that was intentional. I think it was just that total dilemma about what people were going to do and how they were going to adjust education in the broadest sense.
Elizabeth, what was your experience?
Yeah, I think in the initial stages of COVID, education was pretty much non-existent for our families. I think as we progressed through COVID, you know, teachers did become more creative and did try their best to, you know, develop learning tools that could be used across Seesaw and across kind of, you know, different electronic platforms. But it was very, very difficult for families and for some individuals. You know, that is not an effective way for them to learn or engage either. But yes, I think they very much did feel very forgotten and very much left behind when it came to education. And I think, going back, you know, to some of your first points is about the education environment, and the education environment for individuals with PMLD is not solely about learning. You know, there's so many more aspects and so many more layers to it. So as much as, you know, schools did try, you know, with best will in the world, that individual still couldn't get into an achiever bed and be in a different position and still be engaged at home. That just can't happen. So it was very, very complex to try and create the education setting within the home setting as well. So it was a very difficult time for families.
Thank you both. I want to move on now to hub schools. Jenny, I think you say at paragraph 29 of your statement, at the first lockdown, the need for hub schools was less acute for the families that you deal with, but as the pandemic wore on, that changed. Why was that?
I think that intensity of the caring role, you know, families who were at the initial stages wanting to be really, really protective suddenly were so exhausted. I think they were worried about the level of care that they were able to deliver, and they needed a break. So I think then at that point, people would have been were far more interested and keen to think about how they could have their children going to somewhere also where they were socialising. And I think they'd also noticed that deterioration in physical and mental well-being, and they knew that they didn't have the solution in their hands to support any way of correcting that.
And in your view then, would hub school places have been something beneficial for at least some of the families, children that you were dealing with?
Yes, absolutely. And of course, you know, you could have worked really closely with the families to risk assess how that happened. But I think for those families that were at absolute breaking point, it could have been the lifeline that they needed.
I was going to ask, given the complexity of the support needed for some of these children, many of these children, would hub schools have been a viable option for them?
They would have had to have really thought about what was needed. I mean, I think the issue also, and probably some of the reluctance, is for some individuals, managing the care and the complexity of care needs somebody that really knows what they're doing. So it would have needed known carers to have been involved in that. So, so that adds another layer, doesn't it, to how those schools were able to work. But for others, it would have been easier. But yeah, there would have needed to be more consideration about how that complexity of need and understanding people's communication, which is, I guess, where our PAMIS digital passports, we were hoping, would have been part of the solution, that you could have understood a little bit more about an individual.
And were the criteria for these hub schools, was that clear and consistently applied in your experience as an organisation?
I mean, I think I was fairly honest. When we started talking about hub schools, I began to feel really uncomfortable and thought, what did I miss? Because I don't remember us giving an awful lot of information out to families. There were a couple of families I know that had them, but they were frontline workers. But I have to say, whether it was my fault or whether it wasn't clear, I didn't feel when I was asked that question before, that I was completely clear about how the places were allocated, and I think I felt very much that it was about frontline workers. Elizabeth, I don't know whether you were any more.
I think there was a very small minority of families involved with PAMIS who were able to access the hub schools, as Jenny says, really just kind of frontline workers. I know there were some families that I supported who were really, really desperate for their children to be able to access the hubs, and those families were the parents of children who were more mobile, and we've already touched on that. But my knowledge of the hub schools was that they were very much being used for individuals who were under child protection orders and things like that. It was to get them back into the school environment, and to start re-implementing those kind of observations and assessments and things like that. But there was very few families that PAMIS supported that were able to access the school hubs.
Thank you. And I think, Jenny, you say you don't recall there being a focus or prioritisation on supporting the families that PAMIS deals with to have a hub placement. Is that a lesson that you would like to be learned for the future, that if we were to ever end up in a situation similar to the pandemic again?
Yeah, absolutely. And I think we would all need to work collectively. I mean, your question about the staffing, that would need to be really well considered. And yeah, that bit about making sure that we're all aware of what that criteria is, because you have that nag at the back of your mind that you missed something. But it would need a collective approach, and it is something I feel we should be thinking about now, because doing it at the point is just not going to work, because it will take a lot of planning.
Thank you. I want to move on now to the reopening of schools. What was the attitude of the families that you were dealing with to the reopening of schools? What were the emotions when that was announced?
It was fairly mixed, wasn't it, really? And I think, the schools opened at different times as well. That became really difficult for people who had their kids in one, I think as you were talking about, one local authority, and then the school in another local authority did open, but it hadn't opened in that area. But there were definitely mixed emotions for the families that had kids with very profound physical complex disabilities. There was still that anxiety about how they would be managed, and were we taking all the precautions to enable them? But for other groups, there was an absolute relief that their kids could get back. You probably have more first-hand experience.
I think that's really accurate what Jenny says. I think, again, there was very much two camps. You had families who were at breaking point, particularly for those individuals who were more mobile, and really, really desperate to get that kind of structure and routine re-implemented. There was the difficulties around kind of transport and where the school resided, and local authority and cross boundaries and different things like that. But you also had families where maybe their individual had experienced COVID, or they were very vulnerable in terms of health, and they were still really worried. They were still very, very cautious about how COVID and kind of hygiene and different things like that was going to be controlled. So yeah, I think there was very much two thoughts amongst families, yeah.
And there was a real anxiety, I think, in siblings who were going back, knowing that they were going back into an environment where they might get COVID. And that, for that group, you know, I think they are often, again, invisible, but, you know, their worry about if I go into school and I bring it back and I give it to my brother or my sister, that was really difficult, I think, for them. And for family carers who were teachers as well, being asked to go back in when they didn't feel actually that it was safe. I think families felt that they weren't involved enough in the risk assessment about whether it was okay to be going back.
Yeah, you mentioned risk assessments because it's something I think you both touch on. So obviously we're talking about the reopening of schools, but I think you both talk in your statements about how that wasn't necessarily the case for some of these children. They perhaps only went back part-time. What was the reason for that? What were these risk assessments saying that meant that was the result?
I think it was very individualised to how that individual presented. For some of the families that we support, their young people may have excess saliva, they may smear, so faeces and things like that. So obviously that's very kind of high risk in terms of the spread of infection, and you know, the decision was made. How that decision was made, I'm unsure of, but there was decisions made that some individuals would return to school full time, other individuals would return to school on a kind of part-time basis. So it was very difficult, and for some parents very infuriating, as you can imagine, but I don't really think the risk assessments were really communicated well to parents and carers. I don't think there was any consultation, as far as I'm aware, in terms of the content of the risk assessment, or how they had really reached those decisions. But equally, I appreciate that for schools they had a duty of care to their own staff teams as well, to make sure that they were safe and that every precaution was being taken and the rules were being followed. So it was a very, very difficult time.
I think all the way along we've talked about joined up risk assessments. I mean, we learned so much from families. I mean, we were becoming risk adverse and then met with families who helped us develop that risk assessment. And it has to be something that, you know, you move backwards and forwards and you share. And the family said to us, do your risk assessment, we'll then add another layer. And actually, if you don't think you've got it right, we won't be coming anyway. But, you know, they're the absolute experts in how they manage that, particularly infection control. And I think for us, that sharing of that responsibility, which is what it is, was really important, and it enabled both parties to make informed decisions. But I think there is a lot throughout the whole of the COVID pandemic to learn about how we carried out risk assessments and how we implemented them and how they weren't tick boxes, because, you know, I think a lot of families just felt that somebody had been told to do it, they did it, but they hadn't really individualised it in the way that they should, or looked at solutions that, you know, families have come up with the most amazing ideas to minimise those.
And Elizabeth, earlier on in one of your answers you mentioned transport. Did that, and we talked earlier on in evidence about the importance of that and the journey for children to get to school with PMLD. Did transport resume seamlessly when schools reopened?
No, because transport was still under restriction as well. So I think a kind of average school bus can carry maybe about kind of 8 to 12 individuals, depending on the support needs. But when schools reopened, there was still restrictions in place in terms of transport. So most families rely on transport to get their children to and from school. Some families do have access to adapted vehicles where they could maybe have dropped children off at school, but not all families have access to cars or adapted vehicles. So even for the families where maybe school was reopened and there was a place there for their individual, they couldn't actually get them to school, and using public transport isn't always an option for the families that we support either. So yeah, it kind of added another layer of complexity onto the situation.
And that presumably impacted their ability to attend and participate in their education.
Yes, absolutely. And schools obviously had to, make sure they were adhering to the restrictions that were in place in terms of transport and risk assessments and things like that. But the wider picture meant that obviously there was individuals who weren't able to get to school.
And Jenny mentioned this a moment ago, and it's something you also touch on, Elizabeth, at paragraph 83 of your statement. You talk about different practice happening within a local authority. Was that your experience? It was happening. Was that local authorities, or just within a local authority that you were seeing a difference in practice on reopening?
Yeah, I think each local authority was implementing, the guidelines and the restrictions, differently, and that came across obviously in their risk assessments and their communication to families. But I think even within, I only work within one local authority, so you could see the differences between schools, and that was the interpretation of, the head teacher and the staff teams who were developing the risk assessments and implementing how things were going to resume again.
And what did that mean then in terms of consistency of support being offered by local authorities to the families and children that you deal with?
It meant for some families that they were returning to services or school full time, or they were having multiple services re-engage with them, and other families not returning to school and having no services re-engaging. So it really tipped the scales, if you like, and then I think, families started to become quite resentful and quite angry. Why can X person receive this service and be educated, but yet, we're getting absolutely nothing at all? It seems really, really unfair. So yeah, it was a difficult period on top of a prolonged, very, very difficult period for families.
Thank you. And on the return to school, I think, Jenny, at paragraph 71 of your statement, you mentioned reports being made to PAMIS family support directors of issues for children with change, with returning to school. What were those issues that were being reported?
I think for some families, getting into a routine of getting up and going to school had maybe taken many years. You'd then had a really extended period of not doing that, and so that was, you were changing the routine yet again. So there would be people that would be exhibiting that in behaviours that were challenging. There'd be issues. I mean, I guess also for the families, when they're exhausted, to get themselves back into the routine of getting people to go, but also they had lost so many skills, so that understanding and the ability to then engage in class, and you spend years increasing somebody's level of concentration period or their social engagement, and then suddenly you don't have anything and those skills regress. And I think going back into a really busy environment when you've had a sensory, no sensory, it's been a sensory deload really, you're suddenly overloaded from that sensory experience, and probably being then with staff that you don't know, and it is all that having to develop new relationships as well. I mean, it was almost like starting school completely afresh for some people.
Thank you. I want to move on then to transitions. And Elizabeth, I think it would be helpful just to start with if you were able to explain why this is such an important phase, if you like, for the group of children that PAMIS deals with, please.
Obviously, for all the kind of issues we've already raised, so the complexity of the individual's support needs, that kind of wrap round overarching support that they receive at school. Many of the schools that young people access are what we call throughput schools, so they start at nursery and they continue within that same environment until they leave secondary education. So, transition for parents and carers and young people is very, very difficult. We know through research, for our group, it's an exceptionally difficult time, but we also know that it's not done particularly well, and obviously COVID didn't help that at all.
Why is it difficult under normal circumstances, even leaving the pandemic aside for a moment? Why is it a difficult process?
It's a very frustrating process for families. It's very long. Everything is changing. So, the the professionals who are involved with the individual at school, from children's services, they're all being phased out, and new adult professionals are being introduced from the adult teams. So you know, that consistency of staff is starting to dwindle. When that adult team comes on board, is quite sporadic. There's no set timelines of when, you know, these new professionals will come on board. So for families, it's very, very frustrating. There's so much change in terms of, you know, who's going to supply incontinence pads, who's going to supply the milk feeds, you know, all these different things. But the key kind of people within transition are children and family social workers and adult social workers, and historically transition has just always been a very difficult period in people's lives, but the allocation of adult social workers who trigger the assessment, the budgets, you know, the planning tools, don't always take place in a timely fashion to enable all that work to be done, which enables the family to then know where their young person is going to go at the end of term, which then impacts on if they work, on you know, support roles and different things like that. So it's a real minefield to try and navigate. And in terms of getting answers and finalising plans, it's very, very difficult, and more often than not, young people leave school without a full transition plan being in place for them.
Thank you.
Chris, can I just, and if you add a layer also of bereavement, you've had, I mean, I think you, Elizabeth, talked about, you know, when you're in a children's service, that service becomes like your family. So you've had them from a very, very early age up to the age of 18, and then suddenly that family are taken away, and I think during COVID, you know, that the all the work that Elizabeth would be doing on making sure that people were, and then the schools do, leaving, you know, and they're having those breaks, that time, you know, just went. So there's a bereavement layer on top of that, and also it's yet another area where, you know, people know that their kids aren't going to university, they're not going to college. You know, it's another sharp reminder of the fact that actually this is the next stage of a very, very long life that you've got in your caring role.
Thank you. In respect to the pandemic then, you both highlight transitions as being difficult, both from primary to secondary education and also from education to adult services. I think you both say, Jenny, you do this at paragraph 48 of your statement, and Elizabeth at paragraph 64 of yours, you talk about young people in transition being left in limbo. Why was that the case during the pandemic?
Do you want to go? Well, there was no social workers, were starters.
I think during the pandemic, you know, schools were closed. Education plays a massive role in driving the transition forward. So education starts to prepare parents about the transition, and they start doing that maybe around about kind of 14, 15. Most families don't want their young people to leave school. You know, if they could get them to stay on another year or another 2 years, they would be absolutely delighted. So they don't necessarily want their young people to stay on, but school are the driving force behind transition. School frequently will reach out to social work departments to bring the multidisciplinary team together, to get everybody around the table and discuss transitions and try and provide information and advice for parents as well. But with schools being closed, there wasn't that same driving force. So there was no transition discussion, there was no transition planning. There's lots of work that families do independently in terms of transition. So they will start to read about you know, legislation, they'll start to read about the process, you know, they'll look at the assessment, and they'll start to think about what information they need to share about their young person. They'll contact care providers and day services and colleges and things like that independently. So they do a huge amount of that preparation work as kind of independent family members. But with the closure of the schools, that driving force wasn't there, and in conjunction with that, services were closed, colleges were closed, so there was no access to information, and nobody could provide information on when these services were going to reopen, what they were going to look like, you know, would there be availability. You know, it just became a point where their young person was leaving school, but nobody knew what was going to happen. But what they did know was their young person wouldn't be returning to school. You know, that was what they did know.
And in many areas, trying to get hold of a social worker, so across Scotland, there were definitely a lack of adult social workers being able to come in, and you needed the adult social worker to come in and start talking about what that care package would look like and how you started that assessment. And for some families, there was just no social worker at all.
Yeah, so families need to be allocated an adult social worker. So even if they have a children and families social worker, they cannot do that piece of work. So it was the lack of allocation of adult social workers to drive that process forward, because it doesn't matter how much work the family do or the school does, it needs to be the adult social worker who conducts the assessment and puts that assessment forward, and follows the kind of internal process for gaining an SDS budget, which then allows the family to plan and secure a package of support for that young person. So without the adult social worker, none of that work could actually go anywhere.
And given what you said, are you therefore aware of adverse impacts upon particular families or children that you dealt with as a result of what happened during the pandemic, or didn't happen, perhaps?
Yes, absolutely. We had many families whose young people left school, and sadly, because of the pandemic, there wasn't that marker. So schools always make a point of arranging activities to signify that this is the end of school. It's closure. You know, school has finished. So things like proms and you know, activities such as 10-pin bowling, things like that, where that's a clear indication that this is the end point of school. They're usually presented with kind of photographic book of kind of memories and things like that. So none of those kind of milestones happened for families. And then the young person just left school, didn't see that team who'd supported them for a long period of time, but didn't have anything to move onto. So we had a number of families whose children remained at home for over a year because services had reopened but were very slowly reopening, or there just wasn't capacity, or there hadn't been assessments carried out, so there was no budget in place. So it was all these different layers of the transition process that they hadn't gone through, which meant that they couldn't access a service.
And with the lack of opening of day services, I think we've still got families who have no services, and we've had parents that have had to give up work because they've had to provide that care full time. And that bit about, you know, being in a routine, so being able to move from school straight into a day service, so you're still in the routine. But if you lose all of that, you know, for some people, young people, that might never come back, and so getting them into a day opportunity will be really difficult.
Thank you. Finally then, I want to just turn to lessons learned, and to an extent perhaps we've covered some of these already, but Jenny, paragraph 89 of your written statement, you say that the Scottish Government should have considered that school isn't just about education for our young people, and Elizabeth, I think you made the same point in evidence earlier on today. What is it you mean by that?
Well, I think as Elizabeth was highlighting, you know, there's education, but there's also the whole health component. And the school is the place where the whole team come together, including the family carers. And that's the place where, you know, you develop treatment programs, you develop protocols for moving and handling. You know, there's so much more than just about education. And that healthcare was completely missing. And we need to think about, well, what will we do if that ever happens again, and how will we make sure that these kids get access to their equipment, get access to the right advice, and aren't enabled to deteriorate in the way that they did, both cognitively, sensory and physically.
Elizabeth, would you add anything to that?
No, I completely agree with Jenny's statement. You know, I think it was a massive oversight to just think that it was education and education alone, because it's so much more than that, and I think that needs to be considered moving forward. The various different levels of support that school provides to families, but also the kind of encompassing kind of health aspect that it provides to families as well.
Thank you. Before we conclude then, are there any other particular lessons learned or indeed anything else that we haven't covered yet today that you'd like to make clear to the inquiry at this time?
I suppose for me, I had a conversation on Friday with a mother who is a teacher, and it just made me really clear that it's not about the lessons learned, it's about what we remember of how we reacted in a time when we had high infections. So this mum is a lone parent and was asked to provide support, she's a teacher, to go into a school where half the kids were off because they'd come back from a field trip, half were off because they were too ill to come because they had COVID. But there were a number of them that were able to come, but they had COVID, and the teacher herself had COVID. And this mum was asked to go in to a classroom full of the infection, and when she said, "I can't do that," you know, there was an aghast. Well, why not? Well, because I'm a mum who, if I get COVID, I won't be able to look after my son, and I'm the sole carer. But if I take COVID back into the house, my son will end up, as he had done previously, in intensive care with COVID. And I just thought, you know, what have we forgotten about the fact that, you know, our kids are still really, really vulnerable, and they will still die of COVID. And it just seems that all the things that we put in place before just seem to have disappeared. And we had another mum who had asked people to wear masks because she was so worried, you know, that particularly in the winter her daughter might end up with an infection, which she did, but people were refusing to do that. And so it's not the lessons learned, it's what we were able to do at that time. You know, why can we not put in processes and guidance that gives people permission to do the things that they did before to protect the most vulnerable in our communities?
Thank you. Elizabeth, was there anything else you wanted to add at this stage?
I think probably just recognising how isolated parents and carers were, and the impact that that lockdown and COVID had on their health and well-being, you know, and we need to make sure that our parents and carers are valued for the roles that they're doing, and make sure that they are protected, because they are, many of them are sole carers, but the amount of caring hours that they provide to their children is astronomical, you know, and they weren't supported, they were left isolated, and they were left alone.
Thank you. My Lord, I don't have any further questions subject to anything that you may wish to ask or add.
No, thank you very much, Mr. Stephen. No, I've got nothing that I wish to add or ask, except to thank both Ms. Miller and Ms. McElwraith for their evidence. I'm very grateful. That brings an end to this session, and we will return at 1:45. Thank you very much indeed.